Good afternoon. Thank you for joining us today for a community briefing. Today, up first, we have Mayor Sarah Karen. We have Lisa Johnson with the Department of Labor, Lauren Diekman with Jenkins Living Center, and Dr. Dan with Brown Clinic. I'm Jennifer Bender with Prairie Lakes Healthcare System. I'm one of two PIOs. Captain Rehorst is also here with me. Up first, Mayor Karen.
Good afternoon. Today is Thursday, and May 21st. Okay, I don't have the right date on my calendar here. We have 4,250 cases in our state and 48 deaths. Cottington County rose today up to 20 cases. 15 are recovered. We now have 5 active cases. That's just in Cottington County, and we do have other cases that are around us in the counties nearby, and those counties that would come to our stores, use our restaurants and bars, our recreation facilities, and come to our hospital. And of all those counties, Roberts, Grant, Hamlin, Day, Dual, Clark, Marshall, and maybe even Spink, we have a total of 27 cases. So this is really, we're starting to see the numbers go up a little bit, and so we want to pay attention to that. There's a lot on the people's mind having to do with our quality of life here in our park department. Our park board has some pretty tough choices to make. Because of the whole COVID situation, the revenues are expected to be less this year, and it is sales tax revenue that supports our park and recreation department. So we will have to cut some things in order to make the budget work. We might have to cut several $100,000 out of the city's $5 million budget for parks. So over half of the cost of the park department is for staff. And that's the people that run the various different programs. And some of it's the operating costs too. Like the swimming pool, for instance, costs several $100,000 to run each year. And if people don't use it, there's no revenue generated. So the park department will be deciding very soon which of these programs to go forward with. And it's a tough choice for them. I would urge everyone to please think about the decisions that they have to make. They're not taking it lightly. They're factoring a lot of things into it, and your safety is number one. So quality of life is really important to us, and they're remembering that. So please be supportive of the park board as they make these choices. And remember, our formula for success here in fighting this COVID disease is using common sense and personal responsibility. It's very important to keep physical distance between you and others. That will really help to control the disease. Wash your hands and disinfect. And we've been saying that all along. If we keep that up, we will be just fine. And so now I'd like to introduce Lisa Johnson from the Department of Revenue.
Thank you, Mayor. I'm Lisa Johnson with our local Department of Labor office. Our latest number of continued claims is 23,388 for the week ending of May 2nd. This indicates the number of unemployed workers eligible for and receiving benefits after filing their initial claim. We have seen increased numbers of claimants not completing the weekly request for payment. Please be sure to answer all the questions correctly and hit submit. Each claimant is required to file a weekly benefit payment. A, by calling 626-3212 after 6 p.m. on weekdays, or filing online anytime at raclaims.sd.gov. Benefits are not automatically paid out, even though the work search is currently waived. To ensure your benefits are not denied, claimants should file a weekly request for payment in a timely manner. Claimants do have 7 days from the end of the week to file for the previous week. The claim week begins on a Sunday and ends on Saturday at midnight. If you have received a monetary determination from our department and need to backdate a claim for whatever reason, maybe pandemic unemployment, you weren't able to file right away, you may do so at our website, raclaims.sd.gov. Click on Forms and choose the back date and late request form. That will be emailed to our RA division in Aberdeen, or you can mail that as well. Directions are on that form. If you are called back to work, but working reduced hours, you should continue to file your weekly request for payment. You may receive partial benefits, and that will be determined on how many hours you work, but failure to report accurate work hours and earnings may result in an overpayment, which a claimant would be required to pay back. If you earn more than your benefit amount in that week, you are not eligible for a payment that week. Please use our website and our other resources that we have at raclaims.sd.gov. We have video tutorials of how to file your claim, how to file the weekly benefit eligibility scenarios, and other unemployment information. And now, Lauren Diekman from Jenkins.
Good afternoon. My name is Lauren Diekman from Jenkins Living Center. I head up the long-term care sector of the healthcare branch of the Watertown COVID Task Force. Happy to give an update on some things happening in our long-term care facilities. About 2 weeks ago, a recommendation came down from the White House Coronavirus Task Force, which is chaired by Vice President Mike Pence, that all nursing home residents and assisted living residents, as well as staff, be tested for COVID-19. That evolved into a requirement by the South Dakota Department of Health that all of those facilities be tested in a tiered approach. Testing in Tier 1 is nursing homes, which began this week, involves nursing homes that are in communities where there's been an identified substantial community spread of COVID-19. Watertown is one of those Tier 1 communities, so Aventera Watertown and Jenkins Living Center both completed testing of all residents and staff this week. Jenkins Living Center was actually the first facility in the state to complete mass testing. We received a nice unexpected shout out from Governor Noem in her Wednesday afternoon press conference to that effect. Test results will not be available for a few days, and they will of course be reported to the South Dakota Department of Health. If any positive tests are detected, that information will be reported by each facility to the staff and the resident family members involved with that facility. Tier 2 testing will be next for all other nursing homes in communities without substantial spread, and then Tier 3 and 4 testing will involve assisted living facilities. In regard to the testing that took place at Aventera and Jenkins this week, I want to give a shout out to some local folks that really helped in this endeavor. First of all, Heather Wasilk from Brown Clinic, who provided testing assistance and training for Aventera Watertown. And I personally want to thank Shelley Turbach, Chief Nursing Officer, and Jennifer Seek, Laboratory Director from Prairie Lakes Healthcare System, for sending nurses and testing supplies to help conduct almost 400 total tests at Jenkins Living Center earlier this week. The collaboration of these healthcare facilities to accomplish this testing is a testament to how we all work together in the Watertown community to enhance the healthcare of our local citizens. Another thing I'd like to mention, because we get a lot of questions, of course, are visitation policies at Watertown nursing homes. This week, the Centers for Medicare and Medicaid Services, the federal government, provided some guidance to state health departments regarding nursing home reopening recommendations. Reopening facilities to outside visitation would come in phases and would depend on a number of things, including the number of COVID cases in a particular community, the case status of each nursing home, adequate staffing, access to adequate testing, including ongoing testing of residents and staff, universal controls such as social distancing, face covering for residents and visitors, use of hand washing and hand sanitizer, access to PPE by staff, and local hospital capacity. In regard to this guidance from the federal government, South Dakota nursing homes are still in phase 1, which is a complete restriction of outside visitors, with the exception of those residents who are at end of life. At this time, it's not likely that nursing homes in the state will be able to reopen to normal visitation for some time. In the meantime, nursing homes and assisted living communities continue to facilitate opportunities for residents and family members to connect through phone calls, video chatting, window visits, and outdoor visits where safety guidelines can be maintained. Last thing I have is that long-term care facilities in the community continue to have adequate personal protective equipment to meet the needs in our facilities. Another collaborative effort happened in our community when Prairie Lakes Healthcare System sent an individual to Jenkins Living Center to conduct fit testing for all N95 respirators. We're grateful to Jason, I don't know his last name, from Prairie Lakes, but he spent a lot of time with us to do this important testing. Thank you. Next is Dr. Dan Riefenberger from Brown Clinic.
Hello, Dr. Dan. I was going through my emails the other day and I came across one that reminded me of everything going on with this COVID-19 pandemic. It stated, "Dear life, when I said, 'Can my day get any worse?' it was meant as a rhetorical question, not a challenge." Now, if you know me, you know I'm a big believer in exercise. I talk to my patients daily about promoting increased activity and working on our diet. I try to be an example to my patients and not only talk the talk, but walk the talk. I exercise every day. I had a consecutive exercise streak going for almost 12 years. Last year I had my own serious health issues and I had to stop for 1 week. Following that, I then started a new consecutive streak, and now I'm at 15 months consecutive. There's always time for changes. The only real major deterrent for anybody doing exercise on a regular basis is what lies between their ears. We have to convince ourselves of the importance of this and then continue to keep working on it. This is even more important now with this COVID-19 pandemic going on. There are still plenty of ways of being able to exercise and still follow the CDC guidelines of social distancing, good hand washing, and face mask usage, depending on where we are at. When it comes to wearing a face mask, the CDC recommendations state that if we go out and about and we are around other people, the guideline is still to be wearing a face mask. It is a guideline, though, not a mandate. There are plenty of people who still choose not to wear it, and I guess that is their choice. What I would ask of everybody who is not wearing a mask is you don't look at the people who are wearing a mask and act like they're from another planet. Okay? The ones wearing the mask are actually protecting you. If anything, you should be thanking them for wearing a mask. I hear all the time from people that it is just not comfortable having to wear a mask. I, for one, I really don't want to hear that excuse from anybody. I have to wear a mask 9 to 10 plus hours a day. I have to put extra padding inside of just to keep my nose from breaking down. I know it is not comfortable wearing a mask, but I still do it. Right now, with the weather improving, there's not a need to have a face mask on if we're going to be outside. We still can follow the other guidelines. You have heard Governor Noem state many times that this COVID pandemic is a marathon. I cannot think of a better description for this pandemic. For those of you who are not familiar with what a marathon truly is, let me try to explain. I've done multiple marathons in the past, and until you have done one, you truly do not know what this entails or what it really means. This is a perfect description of this pandemic. A marathon is not something you just jump into. It is 26.2 miles. Getting ready to run one can take 4 months and even as long as up to a year to truly get ready for this. This is what we've been doing this whole process in the last several months. Then the day finally comes and you think you're ready. The marathon starts and it takes the first 5 or 6 miles to even get into a groove. And then you start feeling a little bit more comfortable and start finding your pace as you're building up with it. From mile 10 to 15, you're kind of in cruise control, and everything is going along fine. You get past mile 15 and you start feeling it. Things start getting tougher. Your mind starts wandering a little bit more. You wonder if you have done enough to be prepared for everything with this. You keep pushing it, and you finally get at least to mile 20. Things have been going along okay, and then just like that, it feels like you just got smacked between the eyes with the 2x4. You only have 6.2 miles left to go, but that 6.2 miles feels like another 20. That is where it gets tough. You are monitoring things by quarter mile and half mile intervals at that point, trying to get through it to convince yourself that you can do it. You get to the point where you do not think you can finish. And then finally you get there. You feel relief, exhaustion, and the feeling of a huge sense of accomplishment that you did it, just like we all are doing with this current pandemic. Where are we at in this marathon pandemic right now? I don't know for sure, but I think it may be somewhere in that mile 10 to 15 where we may be on cruise control. But it is not over by any stretch of the imagination. It is still coming, and the numbers are picking up. We have not hit our surge yet. We have no idea what this fall and winter are going to bring. But if we keep working on this together, then soon, when all is well, we're going to look back on this period of our life and be glad that we never gave up. This is a different marathon and one that we have never experienced. Finishing a marathon is a state of mind that states anything is possible. So overall, while we are all going through this, be somebody who makes everybody feel like somebody. May is Mental Health Awareness Month. We're all struggling at this point. If anybody tells me that they do not have some degree of depression or anxiety, then I seriously have to wonder where they've been. That is also what makes exercise so important. Exercise is the most potent and underutilized antidepressant there is, and it's free. With this Memorial Weekend holiday coming up, this is a perfect time to get outside and move. We now have 3 days where we can enjoy the holiday. We all know the weekends go too fast. For many of us, it is a time to try to relax and recover from the week. We all know that those first 5 days after a weekend are the toughest. I challenge everybody with this holiday weekend coming up to shut off the TV, shut off the radio, and get off Facebook. Get outside and enjoy the weather. Utilize the trail. We have 30-plus miles of trail in this town. Walk the trail along the lake and enjoy the weather. Utilize it and ride your bike around the lake. This is a great time to get out and forget about everything else. There's a warning with this, though. Exercise has been shown to cause improved health and happiness. Get out and experience it. When you cannot control what is happening, challenge yourself to control the way you respond to what is happening. That is where your individual power is. Believe in yourself. I talk about this all the time on my blog, Strive to Survive, where Strive represents securing time for regular involvement in a variety of exercise. Get out and move. At a time when social distancing is necessary, distancing from physical activity is not. I encourage each of us to prioritize physical activity and make it fun, and not only to enjoy the long-term benefits it provides, but also the immediate improvement it can have in your overall well-being. Exercise is a great coping strategy to utilize for ourselves. Many of our road races and fun runs, walks were canceled this year. Watertown Dash is still having a Run from COVID 5K run walk event, which is a virtual event that you can sign up for and do anytime between June 19th and June 21st. All the proceeds go to the Boys and Girls Club, and it is a great way to get out and move. Exercise is my escape in the evening after working all day. When I am out for a run or for a walk, I settle my own disputes and conflicts that came up during the day. I do not know why, but answers seem more obvious and problems less troublesome when I am in motion. I think you would find the same thing. Have a great weekend coming and a safe weekend, and I hope to see everybody out on the trails. Thank you.
Well, thank you, everyone. Thank you, Mayor Karen, Lisa, Lauren, Dr. Dan, for all that information there. I just want to mention a couple things here quickly. The food distribution is still taking place. That's going to start right here at 4 o'clock, which is in just a couple minutes. That's up at the Boys and Girls Club of Watertown. To line up for that, you're going to want to, again, start at Highway 81 and Arrow Avenue. You're going to go east all the way to 9th Street, and you'll be directed north there to the Boys and Girls Club. No access from 3rd Avenue, and they'll start right at 4, so please do not line up before that. And they'll go as long as supplies last. Next up, thanks to everyone who showed up for the parade yesterday. I was out there putting it live on our Watertown Police Department Facebook page, and it was pretty impressive to watch, so thanks to everyone who went out there and supported that. Speaking of the high school, this weekend, I know that Dr. Dan said stay off Facebook and everything, but we do have one thing you might want to go on for, and then you got to go back outside, and that's the high school virtual graduation that's taking place on Sunday, the 24th here, and that's going to be at 2 p.m., and that's going to be streamed live on GovTV from the City of Watertown, as well as KWAT, KXLG, and the Watertown Public Opinion. That's going to be on their websites. They're going to stream that live. So they've all set that up. They had all the students come across, receive their diplomas, and they have some speeches in there, and they're going to put all that together, and they're going to stream that this weekend, Sunday the 24th at 2 p.m. So maybe take a look at that, or maybe be outside and watch it on your phone, do something there, but watch that. Thank you to the school district for putting all that together. One last thing from the school district, the free food meals, the lunches that everyone's probably been getting there, the students and that there. This is the last week for that the school district will be taking care of that. And then next week on Tuesday, the Boys and Girls Club will be taking that over. So, and the last thing I have is have a great holiday weekend. When you go out, please plan ahead. If you're going to be drinking alcohol, plan ahead and make sure you have a ride and you have that sorted out ahead of time so someone doesn't get hurt or killed, or you end up with a DUI or something like that, because our officers will be out there watching this weekend and enforcing that, because unfortunately over the holiday weekends we do see an increase in alcohol-related injuries and deaths as it relates to traffic accidents. So please go out there this weekend, have a great holiday weekend, get outside like Dr. Dan said and enjoy the weather, get some exercise, clear your mind, and be safe and be responsible while you're doing that as well. So that is all I have for today. We'll turn it over to the media now if there are any questions from the media. All right, if there's no questions from the media, we'll see everyone again next Tuesday, right after the holiday weekend, Tuesday at 3:30 p.m. We'll see you then.